Hi, I'm Glenys Wilson. I'm a senior clinical psychologist you may have seen me giving talks at NADP conferences. My specialty, if you want, trauma, adolescents and youth, and neurodiversity. But what I'd like to talk about today is COVID-19 and some mental health strategies for dealing with stress and anxiety in it. It's a very scary situation. It's most unusual. The other day we were out walking and there was helicopters and obviously monitoring the parks around where we live, and it's a very, very surreal situation. Let alone, no fewer people out in cars and things like that. And many people are struggling with stress and anxiety levels with this current outbreak, which is called Covid-19 because it started in 2019. Fear and anxiety can become overwhelming, but having strategies to cope with the stress will make you, your household, and overall your community stronger. I mean, everyone reacts differently to stressful situations depending on many things: background, personality, the things that make you different from other people, the support you're receiving from families and friends, and how you yourself are educating yourself or what you're doing around containing your own anxieties, which are quite natural to have in these situations. People who may respond more strongly to the stress are older people who are at higher risk, people with conditions or on medication that also puts them at a higher risk, children and teenagers who don't fully understand the situation, people who are on the autistic spectrum or with similar neurodiverse conditions who tend to hyperanalyze and super focus on the situation, people whose thoughts tend to go in circles and they get stuck in loops. We call it ruminating, and it can be hard to step back and stop doing it. And people who have mental health conditions pre-existing that include anxiety and depression. So what does stress look like? Fear and worry about your own health and the health of loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, and other drugs. And there's things you can do to help yourself. Taking good care of yourself physically as well as mentally, keeping in contact with friends and family, and hearing what they're doing and joining in on activities online if you can. Helping others cope with their stress can also help you make community stronger. One thing we're doing is putting up a teddy bear with a rainbow in the window, because I can't even remember where it started, but we saw on Facebook somebody said that children are going on walks and they've put up rainbows for them to count. So we drew a rainbow and put it up in the window, and it sort of is a nice thing to see. And we have had kids sort of pointing at it, and it's sort of helping them to distract. We've also asked neighbours and exchanged telephone numbers with a vulnerable neighbour to ask if when we get our shopping or if we go shopping, which we do rarely, but sometimes we have to get something, can we get anything for them as well? It helps to help. It helps to feel like you're doing something and not just a victim of this media hype and fears that are awash through community at the moment. People with pre-existing mental health conditions, and obviously physical ones as well, should really continue with their treatment in terms of medications. A lot of therapists are doing online sessions or telephone sessions, and to keep an eye on themselves and ask the people around them to keep an eye on their symptoms and see if there's anything new's coming up or if they're worsening. Things you can do to support yourself is take breaks from watching, reading or listening to the news, including social media, hearing about what's happening and people's fears and the death rates and cases of people who've got it can be really distressing and upsetting. Take care of your body. Take deep breaths, stretch, exercise, meditate. Try to eat healthy, well-balanced meals and stick to a regular bedtime. Um, I don't think you can totally avoid alcohol if you're a drinker, but be careful about how much you consume. Um, Take time to do activities, that you enjoy. Like me, everybody is probably, but said, "Oh, I'm so busy. If I wasn't so busy, I'd order my books. I'd read that pile of books. I'd do the garden." Well, what better time have you got than to actually do it now? Um, Friends of mine in Australia are putting up different pictures on Facebook every day. They're getting dressed up as if they're going out, and they're finding that that's quite enjoyable. As you can see, I'm not dressing up for going out. Just got a hoodie on at the moment. Um, so if you find you're just sitting around in pajamas, maybe get dressed, get out of pajamas. Um, get dressed if you're going to do out the work out in the garden, and get into gardening gear. Do something that makes a difference to your routine. Don't just sit on the couch wearing your pajamas every day. Connect with others on the phone, online conferencing, phone and website chats, web-based chats. Talk with people you trust about any concerns and how you're feeling. Call your GP if stress is affecting you or anyone and members of your family with daily activities for a few days in a row. What can you do to support students, families and friends? Make certain when you're posting stuff or you're talking to people that any information you share is accurate. There is so much happening in Facebook and on the news and that is fake, that is inaccurate and just people scaremongering or just repeating rumours that they've heard from their best friend's second cousin's hairdresser. Make certain the facts you share with people or that you look up, check they come from a really reliable source. This fact sheet concentrates on you and your family, but can also give you ideas to pass on to students. And saying that, there will be a fact sheet. It's not just me chattering away and you have to take notes. There will be a fact sheet put up as well. Children and teens react in part on what they see from adults around them. So if you're well informed, if you keep yourself abreast of what's going on and you're keeping your regime of hand washing, disinfecting stuff and looking after yourself, you're going to be calmer, which means anybody in your care will be calmer as well, really of any age group, but children and teens in particular. Parents and caregivers really are the best support for kids. They give a model for how to react. And as I said, if parents and carers are calm, kids will be more calm about it as well. And that's been shown in numerous disasters or serious situations of any type. If the carers or teachers of the kids are calm, the kids will be calm and they recover far better afterwards from any traumatic event they've been through. So if you can be reassuring, it helps them prepare and helps for a better prognosis in the longer run. But not all children and teens respond to stress in the same way. Some common changes to watch for is excessive crying or irritation, and obviously this is a change from normal behaviour. So if you have got someone who has temper tantrums all the time, then another temper tantrum may not be a sign of something other than what they normally do. But if change of behaviour happens, returning to behaviours they've outgrown, like bedwetting, temper tantrums, fears or anxieties, then that's something that gives you an indication that they're extra stressed. Their normal defences and the way they've overcome those worries and fears and behaviours in the past aren't working anymore. They need to be reinforced. They need to get a bit of extra attention and TLC to get them over and remind them that that's something that they've already beaten, if you want. Unhealthy eating or sleeping habits, irritability, acting out, especially in teenagers, and a difficulty with attention and concentration, avoidance of activities that they've enjoyed in the past, unexplained headaches or body pains, and for everyone, increased use of alcohol, tobacco or any other drugs. So there are many things you can do to support family and friends and keep an eye out for things. It doesn't mean you need to be obsessively watching everybody's behaviour, but it can be a good idea to just every now and then run your eye over and see how everyone, including yourself, is handling things. But with kids, you do need to take time to talk about the outbreak, answer questions and share facts about it in a way that they can understand, reassuring them that they're safe, let them know it's okay to feel upset. But these are the very practical ways that we're managing how you come back inside. You wash your hands, you disinfect your hands, you take off your jacket and put it somewhere in a separate room, or whatever you're doing that sort of keeps the house as a safe haven. Um, as I said before, limit your family's exposure to news coverage. There's so much incorrect information that you need to be really clear on what's a reliable source and what's not. Making certain kids don't get incorrect information and then obsess or fuss about it. If someone appears to be stuck in a repetitive cycle of thought or obsessing about it and can't let go of a worry, then suggest an activity, a game, start a discussion on another topic, do something very different, move them to another room, do something that's going to involve their body and their brain. That could be as simple as get out a jigsaw puzzle. Regular routines might help because schools are closed. A lot of people may just see, especially teenagers, as a really good excuse for just lying in bed all day. But really, you need to, without going overly berserk, you really need to get some sort of routine. A schedule can be reassuring. Knowing what's going to happen in advance can be helpful, especially for people on the spectrum or other neurodiverse conditions. Others might need home to be completely different from at school. And their stress levels will reduce if they're encouraged to take control of their own education or their own activities. You might want to sit down with those and make a list of activities and just sort of say, okay, do you want to do a pick from a hat what you're going to do today? Or do you want to just work through your list rather than you imposing a list? Others might want some sort of schedule imposed on them. So you need to know and have a chat about what would be a preferable way of operating. And if it doesn't work, change it. That's fine. But be a role model too to other members of your household. You take breaks, get plenty of sleep. Oh, you don't need to get plenty of sheep. Get plenty of sleep, exercise, eat well, and connect with friends and family. And some other tips. Put on music rather than have the television on all the time. Some people like to listen to music without doing anything else. Others like it as a background for vacuuming, cleaning. Experiment. Find out what works for you. Dance. It's fine. It's a good thing too to make certain that you keep things clean, again, because we're out of routine and you don't have to go to work and stuff. People can find it's easy just to put something to the side and gradually a pile of clothes appears at the side of the bed, or books just get put to one side and papers. Every now and then make certain that you're clearing up to keep the area around you clean, and that can help keep your head and your thinking clean and clear, which I'm not doing at the moment. Social contact's really important. It's physical contact that the 2-metre rule is about, or 6-foot rule. Is your workplace running online social spaces? Is your local pub running online quizzes? I know that a few are. Do your young people have access to a safe media space where they can talk with their friends? Games, board games, card games. Get out Twister, get out Monopoly, have a go at it. Scrabble, good for English, that sort of thing. If you're working from home, then creating a to-do list at the start of the day and then crossing things off as you go, and then looking at what you can do the next day gives you things to celebrate and gives you an idea that yes, you are achieving stuff. Writing can be really cathartic. Starting a journal, you could publish it later. One for yourself and a family one. Write down what's on your mind. Write about things that have been bothering you. Um, Write about things you love that make you laugh. Past events that have been on your mind. That's all sort of more of a personal side of things. Um, you can have a family journal, which can help discussions and help keep an idea of people writing down what they've been worried about, and you can discuss it over dinner that night or the next day or something like that. Um, I won't go through it now, but on the fact sheet there's a list of resources about meditation apps, what is being put out by Deaf Umbrella to keep people healthy, and the NHS resources for mental wellbeing. Um, Really, that's all we can do. An NADP is there if you've got questions about how you might better assist people. I'm sure Lynn won't have all the answers all the time, but she'll know where to go or how best to advise you. Um, so that's it from me. I hope this has been enjoyable, and take care.